Good evening, everyone, and thank you for joining us today. We're going to give everyone a few minutes to get logged in and get started. As you'll notice, your microphone is muted just to reduce any background noise, but you can always use the chat feature throughout the presentation. And before we get started to ask any questions that you may have, please feel free to try out the chat by telling us where you're from and what kind of pets you have. We're so excited to have you all with us today, and we'll begin our featured presentations shortly. Good afternoon, everyone. My name is Leilani Favazo, and I'll be your webinar host this evening. I want to welcome and thank you for joining us for the Tail Wagging Treatments Fear-Free in Veterinary Rehab Settings webinar with Dina Kabuchi. I have a few housekeeping items to announce before we get started with today's presentation. As a reminder, your microphone will be muted just to reduce background noise, so please use your Zoom chat feature for any questions. We may not have time at the end to address all questions, but we will try to answer as many as possible. So please feel free to drop those in the chat throughout the webinar. A recording of tonight's presentation will be available for attendees within a week's time, which will be shared via email. For tonight's presentation is brought to you by Fear-Free Pets, where we take the pet out of petrified and put the treat back into treatment. Fear-Free's mission is to alleviate fear, anxiety, and stress in pets by educating the people who care for them. For pet parent clients, we also have our Fear-Free Happy Homes in the Happy Paws podcast. Be sure to follow us on Facebook and Instagram at Fear-Free Pets and at Fear-Free Happy Homes. We're so excited to have Dina join us today to share her knowledge, tips, and tricks. I'd like to give a brief introduction before I pass it over to her to get started. Dina is a licensed veterinary technician who specializes in canine physical rehabilitation and pain management. Dina studied veterinary technology at Mercy College in Dobbs Ferry, New York, and graduated with a Bachelor of Science in 2007. Since then, Dina has devoted her career to canine rehabilitation and massage therapy. She became a certified canine rehabilitation through the canine rehabilitator through the Canine Rehabilitation Institute in Florida in 2010. She then continued her education by becoming a certified canine massage therapist in 2011 and studying traditional Chinese veterinary medicine for veterinary technicians in 2012. Later in 2017, Dina received her veterinary technician specialty in physical rehabilitation. She has served on the APRVT Board of Directors as the Executive Secretary and currently sits as a continuing education chair. Dina is also a member of the International Veterinary Academy of Pain Management and a Fear-Free certified professional. She has a strong interest in teaching and learning, and she actively lectures to the veterinary community and general public. Dina loves to continue to contribute to peer-reviewed publications and educational textbooks. Now, without further ado, I'll pass it over to Dina.
Thank you, Leilani. And thank you, everybody, for being here tonight. Welcome. These are probably my two favorite topics to talk about, fear-free and rehab. And as you can see already, I have a lot of passion in what I do, and I love teaching and educating and be able to provide all this information for you guys. Fear-free and rehab really go hand in hand. This particular lecture is going to be more of an introduction to rehab. So for people who may not have any experience, or maybe you're students and you're not sure which path you want to choose, we got some really great information for you tonight. So fear-free and rehab really go hand in hand because, as you're going to see, there's a lot of things that we do in the fear-free setting that can sometimes be a little fearful for dogs, especially, or cats, especially if they're so used to coming from other environments, whether it's general practice or specialty, and they may already feel this disconnection or nervousness when they're going into a hospital. So we really like to provide a really positive experience for our pets. And we got some really great information for you today. It is a lot. I'm going to respect your time and try to stay on time, but please know that if we do go a little over, I am happy to stay on and help answer any questions. So I'm going to introduce you to the world of rehab, all this wonderful stuff that we do. We'll review the fear-free techniques because those are important and all those cornerstone um, techniques that we do that makes fear free so successful. And then our approach to how we utilize fear free to all these modalities I'm going to introduce you to. And for those that are interested in rehab, we'll talk about how you can eventually get your rehab certification and if you want to eventually specialize. And we'll also talk about the veterinary technician's role in the rehab setting. So jumping right into it. Sorry, I'm just going to move this over because I cannot see my screen. Where is this? I'm sorry. Okay, my little camera is in the middle, so sorry about that. All right, so our goal of rehab is ultimately to restore tissue function. So whether that's orthopedic, soft tissue, or neurologic. And it usually starts with focusing on pain management. So pain is one of the very first things that we really focus on. If you see on the bottom here where I say rehab is not just underwater treadmill and laser, and you'll see we'll talk a little bit more about that. Sometimes when people refer for rehab, they tend to refer mostly for laser and underwater treadmill, but I'm going to show you that there's so much more that we do. One of the main things that we like to focus on is actually pain management because pain leads to a dysfunction. And our ultimate goal is to help these patients restore tissue function. So whether that's through orthopedic, neurologic, or soft tissue, we're going to help to improve strength, flexibility, balance, proprioception, and endurance. And we do this by not only all of these manual therapies, modalities that we're going to introduce you to, but also a lot of manual work. We do a lot of hands-on work in the rehab setting. So that's why it's really important for us to really be able to communicate and understand our patients so that we can really create a good environment for them and ultimately allow them to trust us so we can have a really good experience for them. Okay. Oops, I'm sorry. I'm clicking on the wrong thing here. All right. So our rehab exam is a little bit different. Of course, it starts with like your normal exam from head to toe, scanning the body. But what we're looking at is a bunch of different things. We're looking at body condition score. Of course, if animal is overweight, that's probably going to lead to some dysfunction, right? So we want to talk to the client about how can we improve or weight loss, especially if a dog has arthritis or anything like that, that could be kind of holding them back or inhibiting function. We're also going to look at muscle mass. So if we look on the right here, this is a gulick. This gives us an objective measurement of what their muscle mass might be. We can actually measure their body condition as well with this as well. But we usually use this to measure limb girth. So whether it's the front or the hind limb. So if we have a dog that's doing post-op, might have some muscle atrophy. Our goals are going to help to improve strength. So this can give us an objective measurement of where we're starting. We're also going to do some range of motion. We measure with a goniometer. That's this device down here. And what that does is help measure our joint angles. So each joint has a specific angle for flexion and extension. And so it allows us to know almost what the flexibility can be of that joint. So if we're just, for example, doing an elbow and we want to be able to flex the elbow all the way, and then can we extend it all the way? So it lets us know what that function of the joint is based on the range of motion and if we need to improve. We're also going to look for any functional impairment. So whether there's pain, muscle spasms, trigger points, effusion, anything like that that might be causing some dysfunction in their limbs. Or in their muscles. We always look at gait. To be honest, I feel like I can't look at a normal dog anymore because I feel like every dog has some sort of gait abnormality. But we're definitely looking for some lameness when they're walking. Is there any like changes in their shifting of their limbs? When they're standing still, are they offloading, maybe not loading completely on a limb? So many different things that we're looking at in the rehab setting. And then when we create a treatment plan, each treatment plan is going to be specific to a patient, right? So just like in human medicine or even for all of our other animals, every patient is different. So our plan is going to be specific to that patient. And then here we go, jumping right into how do we create this fear-free environment? Well, so for one, the success of fear-free really comes from like overall communication. So whether that's communication between the veterinary profession with the veterinary team and the clients, but also us understanding how do animals communicate. So really understanding animal body language and behavior is really important to the success of Fear Free. If we can understand how an animal is feeling just by their body language and what they're telling us, that gives us a lot of information on how we can approach them and how we can work with them. Because again, our ultimate goal is to create a really positive environment for them, right? So we want to make sure that we're able to communicate with them, we understand what they're telling us, and we're going to be able to communicate back and create a good space for them. Okay. And then we're going to go through a couple of these four cornerstone techniques for of that fear free, what makes fear free so success. Considerate approach, I would say, is probably the most important. This is your initial introduction, right? So the initial interaction between you, the staff, the client, the dog, everything that the dog sees right away. And so really in the name, right, you want to take into consideration or be mindful of what that pet might be feeling and what they're seeing. So a couple of suggestions that we do that we'll say is maybe not make direct contact. I know that this is a little bit different than probably what we're all used to, right? If anybody's like me, I've been a lab all my life, right? So I'm always like, oh my gosh, hi, how you doing? And I want to say hi, I want to hug the animal, but then I've come to recognize that maybe not every pet wants that, right? So I try to give them their space, give them some respect their boundaries. I may not make direct eye contact with them right away, but maybe with their owner. And so while I'm talking to the owner, I'll be throwing out some treats. I'm going to approach maybe from the side or turn my body to the side so I'm not in this like threatening posture for them. And I definitely want to give them some space, especially if they're in a setting that they're not comfortable with. You want to be able to give them some space so that they feel comfortable. We usually say not to reach for a pet, especially overhead. A lot of dogs don't always like when you reach overhead. Sometimes you might be able to put your hand down low. And again, if I'm giving treats, maybe they'll come and take them. We kind of let the animal set their pace. Do they want to come to us versus me trying to force myself on them? And then you also want to be able to consider the environment, right? So, if we're greeting in a waiting room, what does that waiting room look like? Is there noise there, other dogs? Are there things that are going to distract the pet? On the way to the exam room, is there a scale? Is there something in the way that might make them nervous? So we just want to think of all these things that we could almost just think about ahead of time so that this way if we prepare for this animal coming in, we can prepare them for the most success. And then once we get into the exam room, wherever we are, we want to be able to provide them a nice safe place. Gentle control. So this is how we safely position the pet so where they're comfortable and we're safely able to administer veterinary treatments. We usually say in the fear free world that less is more. So, really, no force anymore. I don't know if I'm pretty sure they're not teaching this anymore, but when I went to school, I remember them telling us you almost had to have a kung fu grip on your animals, like just for safety. And that is not the case anymore. And you will find that if you incorporate these techniques and really use less restraint, you actually get more benefit for like out of the treatment for sure because the animal's safe, the the staff is safe and everybody's happy. Okay, we usually like to try to do, if we can, e-collars instead of muzzles. Now, if a dog really does need a muzzle, and we'll talk about this a little bit later, but if dogs are really that reactive and they're like really showing some sort of aggression, we might actually have these animals come in on what we call pre-visit pharmaceuticals. That's a PVP on the bottom, because that's at least going to help to lower the threshold of anxiety and stress, and that's ultimately what we want. And we might obviously navigate our treatments a little bit different if we're working with a dog that does need to be muzzled. Otherwise, we do find a lot of success with using an e-collar instead. And of course, treats, peanut butter, cheese, whatever it is. If a dog has allergies, we'll often ask the owners to bring in their own food so that this way we're still being able to give them something, create a positive environment for them, but then this way we're not contributing to allergies. Same if they're also obese too, or if they're on a weight loss diet, we'll always tell the owners to bring in their own food. As far as cats go, we do actually see cats in in rehab because they have arthritis and some orthopedic issues as well. So we really want to avoid scruffing cats. That is not the way that we handle cats anymore, especially in the fear-free world. Instead, we can place them on a feel-away towel, which just helps to alleviate some fear, anxiety, and stress. And they love, love, love churro. If you've ever had churro, had a cat with churro, it's like crack. So you can try that. Whipped cream, baby food. Again, as long as an animal, not all animals are going to take the food, but if they do, it does create a better experience for them. And then last is your touch gradient. So this is just being able to maintain physical contact between our entire procedure because it just allows the pet to acclimate our touch versus startling them if you were to touch, touch, and release. So in the example of when we're doing injections, like in a regular medicine, although we do some joint injections sometimes or add a coin per se in the rehab setting, I just want to be able to touch the pet in a neutral space, maybe like the shoulders and necks and then neck, and then just glide your hands down to where the injection site might be. And I even go a little bit more to kind of desensitizing the little sensory areas there, where I might just do like a little like tap 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 or a little like shake 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 before I poke, so that this way we're kind of desensitizing the area there, and like they don't usually feel a poke as much. And then also giving treats at the same time. And then with the rehab approach, we're always maintaining physical contact. So we might be like doing almost like a massage in a way, or effleurage. We'll be starting from the head down to the neck, maybe down to the back, and then to the back legs, but always at least keeping like one hand on the dog or cat, so they always know where we are. And so here's an example of initial greeting in the rehab setting. I'm going to play this video. That's have some volume. You're going to hear how anxious this pet can be. And if we look at body language, his tail is tucked, his ears are back. However, he is taking treats, so that's a good sign. And I'm obviously giving him some positive reinforcement for this. But this would be an example of considerate approach. He was in the room. This dog was known to have severe anxiety, that nobody can work with this dog. And I was like, well, has anybody tried working with this dog with the owner? And I don't know why that wasn't a consideration in the past. We're like, okay, let's give him some pre-visit pharmaceuticals. Let's have the owner in the room and let's see how he does. And for the fact that the dog was taking some treats, I thought that was very positive on this dog's behalf, because sometimes if they're really nervous, they won't take treats. But again, I didn't make any direct contact with the dog. I was talking to the owner, wasn't reaching for him, and then just throwing out some treats. And obviously these videos can take a little bit longer, but for purposes of the lecture, we just do it nice and short. But you can see over time, this dog really improved and just loved coming to us. And that's exactly what we want. Oops. Okay. And then so introducing into the rehab room. So again, there could be a lot of stuff that animals are not used to, like such as equipment that they don't see on a daily basis. So if there's no other pets, sometimes if you're in a big facility, you might have multiple pets at the same time. I like the pets to explore the environment. I don't usually do anything with them right away. I'll just let them come in. I'll throw treats around, whether it's by equipment, by doors, whatever it is, just so that this way they can get used to just all the different sites that are in that area. Sometimes we can use essential oils if people aren't sensitive. That's also pretty good. And then I love being able to put out like a nice comfortable bed or like just a pillow blanket somewhere where they might want to lay. And you can also tell your clients too that if they have a place, like some dogs know place, then they can bring that as well to their sessions. And so I love being able to build trust. Keep in mind, we're going to be working with these patients sometimes once to twice a week. So I need to get them to trust me. So I love the touch, what I call the touch game. And so I will introduce myself with like a touch with one hand and treat with another. And then I'll keep doing this and move my hand in different areas. And I think this is a really great just introduction for all dogs, really. Because like I said, a lot of dogs don't like being reached over being reached over their head. So introducing this type of technique for it whenever you're meeting like a new dog is actually it's just a nice introduction. It helps to build some trust. I always like to make it nice and exciting. I like to have like hide treats sometimes if I have to, like if they're like, we have a bunch of scent work dogs that like love searching. So you can put some treats down. I usually like to start with active exercises instead of massage. At some places they might do like laser massage, but we like to start off with that interaction between me and the pet, make it fun and exciting, let me get their attention, and then we'll do some exercises first before we go into anything else. And like I said, I really enjoy having the owners present if we can. All right, so jumping into our modalities. So the first one we're going to talk about is laser. So even though I said that rehab is not just underwater treadmill and laser is a huge component of what we do because it really is probably one of the best modalities that really help to restore tissue healing. So laser actually uses, and you might hear it in other terms called photobiomodulation or low level light therapy. It stimulates, uses light energy that stimulates chromophores, and these are basically like photoreceptors that absorb this light and create a photochemical response. And some of these that we're familiar with: hemoglobin, melanin, water, and one of the main components is cytochrome C oxidase, which actually lies in the mitochondria. And it's in here where we have this great aspect of laser. We helped it with the cytochrome C oxidase basically activates ATP production, and then we have this whole cascade that I'm going to go into. But in a nutshell, it basically decreases pain, inflammation, and restore tissue healing. And how does it do that? So when it comes to wound healing, this with ATP production, we get some good cell proliferation, so new cells, and also angiogenesis, which is new blood cell, vessel formation. So we're basically bringing in a lot of circulation into the tissue, which is ultimately going to help with healing, right? New cells, new epithelial cells, and then fibroblasts, which is basically your connective tissue for creating scar tissue. So that's where it's really great in wound healing. It's also going to help to decrease inflammation. So whenever there's injury, there's always going to be inflammation on site. So we want to be able to help stop that, especially when it's chronic. So your pro-inflammatory mediators like your tumor necrosis factor alpha, interleukin 1, and your prostaglandins. Those are the main inflammatory mediators that usually show up at tissue injury, and that can hang out for a really long time, especially in cases of osteoarthritis. So it's really good for helping to grease that. And then also for pain reduction. So we can inhibit our C and A delta fibers. So we're actually going to slow down the conduction. So if anybody's actually ever had laser before, or if you ever hear your clients say like, oh, they felt really great the next day, we're actually slowing down that transmission of the pain signal. So that helps there. It also helps to activate the body's natural endorphins. So that's why they also feel pretty good, and helps with releasing nitrous oxide. So they got some good vasodilation. So if there's any muscle tenderness and soreness. So as you can see, it's very beneficial. And so we use it for almost everything, right? So in rehab, we do a lot of post-operative repair. So whether it's knee, hips, backs, all different type of orthopedic neurologic surgeries, but then also for conservative management. So if we have dogs that have disc disease that maybe are not getting surgery, degenerative myelopathy that really helps to just kind of maintain nerve connection for as long as possible. Arthritis, of course, arthritis is one of the main reasons of why we use laser. But I work in a general practice setting as well. So we do it quite often for our dentals. So for stomatitis, but then even those animals that are predisposed, your black cats that have like cystitis, that's also a good place for it to help anywhere that we can help control inflammation and decrease pain. And then also soft tissue injuries. So we see a lot of dogs that might have some tendon injuries, muscle strains, especially our sporting active dogs, and then some myopathies where they actually have some like muscle thickening. And then how do I introduce it? So again, you probably can't see the whole laser here, but there's a part of it. So the laser is a scary machine, right? It's like the way that we have it, it's up on a cart, it's got all these little pieces, and it's coming towards the pet. So what I like to do, I'm going to like play the video here so you can hear. Oops, wait, that's the wrong one. Sorry, that's the goggles. Let's go to this one. All right. So I lay it on the floor and I put treats around it so that she can associate that it's not going to harm her. And if you see, she goes towards it, and I mark it with a yes because I'm like, good girl, that was very good. She didn't seem too nervous of it. She willingly inspected it on her own, and she gets treats for investigating and enjoying it. And so this obviously video will keep going further and further, but for purposes of our lecture, we're just going to go a little bit shorter. But this is a good way of introducing, right? Because if we take our time and she's comfortable with this, then we can move on to our next stage, and she obviously eventually allowed us to do it with no problems. Now with laser, we also have to use some goggles depending on what class you have. Because some lasers are higher power, and it just because laser is invisible light, we want to protect our eyes. So we will put some goggles on the dogs, or sometimes cones. So for this dog, I'm trying to get her to do the touch and introduce, and she's totally on to me. She knows that I have treats. She's like, just give me the treat. But I like to give them some time to introduce to the glasses, because I'm eventually going to put them on her head. So what I'll do is just kind of place it halfway. She was okay with it, so I give her a treat. I'll do it again. She's still okay. And for the most part, if you look at her body language, she seems okay. And then I eventually just put it on, and I just keep giving her treats, and she's pretty good. Like her ears might be back a little bit, 'cause she's like, "What are you doing?" But for the most part, she's pretty comfortable. Look how cute she is. Oops. All right, next is therapeutic ultrasound. So where laser uses light, ultrasound is another great modality, because this uses sound waves. And what's really great about this is that these sound waves can really heat up the tissue in like a matter of minutes, versus using like a heat pack that I'll talk about later. So this is really great for improving circulation. So definitely for being able to improve tissue extensibility. So where a muscle might be lacking flexibility, and maybe there's some muscle spasms or some tightness in that, we want to be able to improve circulation so that we can increase that extensibility. It's definitely going to help with pain, and then it also helps to decrease all these fibrous adhesions. So in the event where there might be some scar tissue from like chronic repetitive injuries in a muscle, sometimes when scar tissue lays down, it can be very disorganized. So the therapeutic ultrasound helps with those sound waves, and bringing in circulation helps to reorient those fibers, so that this way we can ultimately help whether it's the muscle or the tendon get back to its normal tensile strength, and help improve that flexibility. So we usually use it often in a lot of tendinopathies. There's like tendons tend to have a little bit lower blood supply. So we really like to be able to improve that blood flow for healing. If there's a myopathy where there's a lot of muscle thickening, it's also a good area that we like to use it. Arthritis, we might use it on if there's a lot of joint restrictions. Sometimes we won't use it, because you actually can use an ultrasound on a non-thermal setting. So we try not to do heat with heat, right? So if there's a very hot inflamed arthritic joint, we might not choose to do the ultrasound at that point. We might choose a different modality. And a lot of patients that go through post-op orthopedic issues, like sometimes have compensatory muscle spasms, where these muscles shorten and they get into a very tight state. So the ultrasound is really helpful for releasing those muscles, so that we can help these patients return to function after surgery. And then sometimes the margins of wounds, we can also help to bring in some inflammation, circulation as well. So here is an introduction for, just like the laser, just have the modality out, and just throwing some treats around, just always creating a positive experience to the modality that I'm introducing. And then on this side, you can see how she really tolerated the treatment. She wasn't complaining. She was very comfortable. And then just for purposes of this video, since this is a fear-free lecture, I just need to inform you guys that my position may not exactly be the best fear-free position. However, because we like to work with our pets, and however they are, she was pretty comfortable. I have a lack of flexibility, so the best thing that I could do is put my leg over her. But that might not be the best position for other people in the future, especially from a fear-free perspective. So again, just be mindful of your body positioning as well. Okay. Electrotherapy. So this is actually a common modality that you might have seen yourself if you've ever been to physical therapy or had an injury yourself. So we have two forms. Neuromuscular electrical stimulation is basically where we're using the electrical current to target our motor neurons so that this way we can help with like muscle building in a sense, or just preventing muscle atrophy, really re-educating the muscle fibers. Whereas TENS, transcutaneous electrical nerve stimulation, is going to be more on your sensory neurons. So this is what's going to help with your pain pathways and desensitizing any pain. And so we can use these both like interchangeably depending on what area that we're using it for. So whether it's post-operative, because if it's post-operative, we can use the TENS and pain settings to help control pain and inflammation. But then we can also use the E-stem setting to help to re-educate the muscle fibers. So especially in neurologic conditions, whether they just had back surgery or if they're conservative management, if there's not enough nerve innervation going to the muscles, they're going to get muscle atrophy. And sometimes dogs, especially after a hemilaminectomy, they might not be mobile right away. So we can actually use the e-stim to help target those muscles, or at least re-educate those muscles so that we don't get further atrophy. Because remember, what you don't use, you lose, right? And in rehab, we want to be able to maintain and restore that function. Very good for arthritis pain. So this is actually a modality that owners can actually purchase online. Amazon sells many different units. Sometimes I'll have the owner bring me their own unit, and I can, based on the settings, I could probably set it for them and see if they can, and something they can do at home. And so you can either put it on the muscles or you can put it around the joints. So really good for pain management and especially for home care as well. Okay, and then these videos were a little slow before, so sorry if they don't work to the fullest. But so this is how I like to introduce. I always, because we want to be able to get the best contact possible, we usually will shave. And I'm sorry, I meant to mention that too for the therapeutic ultrasound. We actually need to be able to shave the hair so that this way we can get the best contact. So in here, I'm basically just introducing the dog to the clippers and just running it and throw a treat so he just knows what that sound is in the background. And then I'm going to bring the unit in and kind of doing the same thing, just doing a treat, showing him the unit. Um, Based on his behavior, so I don't know if you guys caught that real quick. He did like a little whale eye, kind of like, "What are you doing?" But and even like the commissures of his mouth are maybe a little tight, so you can tell that he is a little anxious and a little unsure, but his tail is still wagging, he's willingly taking treats. And his ears are pretty much in like neutral and not like completely back, so I know that he was comfortable with my approach. Of course he's probably like, what the heck, or what is this, what are you doing, but he was allowing me to move forward. And then finally, and this is when you prepare successfully and take your time, then we're able to complete these treatments and they're pretty comfortable with it. And so I also have the owner here because he just loves treats so much that he was moving a lot. So I actually needed the owner to not only help me, but then in this particular video, I wanted to activate the muscle wall and trying to get him to place his limb as well. Okay. And then, so thermotherapy. So, like I was saying before, we can use both of these interchangeably. So, we have cryotherapy, which is basically vasoconstriction. So, when we vasoconstrict, we're going to decrease inflammation. And when we decrease inflammation, we're also blocking that pain perception. So, cryotherapy or ice slows down nerve conduction. So, we are blocking pain perception. And so, that's a really good modality to use in a lot of your post-op cases. I'll talk about that in a second. But usually, we like to use it up in your acute phases. So, up to 72 hours of inflammation or initial injury. And then heat on the other side is going to vasodilate. So, it's going to bring in some circulation, promote circulation. So for here, we like to use it to promote tissue elasticity. So if we're improving flexibility, we're bringing circulation into the tissue so that this way we can help to improve flexibility, decrease muscle spasms. And then if our joints are a little stiff, then we can use some heat to kind of bring in some circulation and reduce that joint stiffness. So after acute inflammation or acute injury, after those 72 hours, in the chronic stages or subacute stages, we can start using some heat. And then I like to use this interchangeably, especially for osteoarthritis cases, because if they are active, we like to call them weekend warriors, right? So they might go out and have a really great day, do a lot of activity, and then they might have a lot of inflammation where they're sore. So I might tell the owners to do some ice to could like to restrict all that inflammation and control the pain in that sense. But then maybe like a couple of days later, if it seems like now their muscles are a little tight and their joints are tight because they weren't moving, then we can do heat to bring in some circulation. The same thing in the post-op stages. So we're going to reduce pain and swelling in those initial stages, but then we might use it on the muscles to help with those compensatory muscle spasms that might be tight. And in neurologic settings, because the ice slows down that nerve conduction velocity, we can actually use it on those. Some of these cases we get what we call upper motor neuron um, signs, where there's a lot of extensor tone and sometimes a lot of spasticity. So we can use the ice to help to slow down that nerve conduction and kind of bring them back to normal so that we can work with them a little bit more. And then my introduction. So as if you caught on, my techniques are pretty much like the same. They're almost like the touch game. I like to introduce everything with a touch, or introduce and then treat, and then introduce and then treat. And again, these videos might take a little bit longer than 30 seconds because it's all about being able to create a nice positive experience for them. And then when she's used to it, I give her a treat while I place the heat. Okay, good. All right. And so therapeutic exercise, this is a huge part of what we do also in rehab. And actually, this is the most fun part. This is where I feel we can really excel as rehab therapists. There's so many different things that we can do to help to retrain function. We're not only going to improve strength, we do balance and coordination. For neurologic guys, we are going to help to improve some proprioception, or their sensory awareness, so they know where their feet are in space. Gait retraining also goes hand in hand with neurologic conditions. But then also for dogs that are overweight, so we want to work on weight loss or conditioning for our sporting dogs. A lot of dogs get injuries. Because sometimes they might not be conditioned appropriately, or they may be what we call over conditioned, where they have too much muscle but not enough flexibility. So there's so many different things that we can do to help them and make it fun for them. And so what we have to recognize is that this might be, well, if we're used to working in a rehab space, we might be used to seeing this, but what do they see, right? So this is where it becomes important to introduce these dogs to a night and make it nice and positive for them, so that they're not so fearful of it. This particular patient on the left here is a puppy. So puppies, we know we have to be even more cautious with, because we know from experience and from science and from a lot of studies that puppies, if they are exposed to some things at a very early age, they'll remember that for a very long time. So we always want to make sure, especially with working with puppies, and they do get injuries quite often, actually. So we want to make sure that we are creating a really good space for them as well. So introducing them to the equipment again. So we're just doing. I'm not asking her really for anything, but I'm just putting treats down. As you can see, with just based on her body language, she's stretching out a little bit. So she's like, what is this? I don't really want to step on it, but that's okay, because I'm not asking her to do that yet, right? I'm just introducing her to the equipment. I'm making it positive for her. She's taking the treats, but then she decides on her own, you know what, I don't want to do this right now. And that's okay. And then we move that away, and then we go on to something else. But at least at this event, she was okay. She was she was accepting the treats. She was fine with the experience, and then we went on to something different. And now this is Jade. She was there in that early video. If you remember, she was a little bit nervous about what is this piece of equipment. So these they're called physio discs. They actually have little textures that help with sensory awareness. So sometimes the dogs don't like that. So what I like to do then is like, let's cover it, right? Let's see if we can do something different. And what I do is, like, as soon as Jade steps on it, because before she did it, now she did, I'm like, yes, good job, reward her. She did it again, say, yes. And before you know it, they start doing it on their own. It's like they want to please, and it's really great. So that's what we want. We want them to make their own choices as well. And so she starts doing that, and she does a really good job. And then we also very much work with the patient. So keep in mind, if you're allowed to have the owners with you, some places don't often allow owners to be there in the rehab setting. But if you can, that's great. If not, we like to work with the patient. So these two particular patients, they were a little bit more on the anxious end. They knew that their owners were on the other side of the door, so we just improvised and worked with them, right? So we end up taking some equipment, putting it by the door. And then for this one, she loved peanut butter. So again, we try to use our resources and work around the patient because we're all about trying to create a good experience for them. And then hydrotherapy. So a lot of benefits to hydro. So not only doing the underwater treadmill, so the underwater treadmills when they're moving against the water. So this really helps the resistance of the water, really helps to improve strength. So definitely great for muscle strengthening. We're also going to help with gait retraining on our neurologic dogs. They tend to walk a little bit better in water than they might on land first. And that's because of the buoyancy of the water naturally makes them a little bit lighter so that this way they can learn to replace their legs. It's also going to be good for weight loss, of course, because they're working against the resistance of the water, but we can increase their speed to help with endurance and improve cardio output. And then also with proprioception, it also helps with body awareness as well. And then on the other hand, depending on what kind of treadmill you have, you might be able to raise up the water a little bit more, especially for a smaller dog. Um, and then this way you can do, if we're doing swimming, that really helps focus on range of motion, especially on the front legs. The hydro might be better, or the underwater treadmill might be better for hind legs if we're rehabbing maybe a knee or a hip. Swimming, hips, I think kind of goes, it depends on the dog, right? Because there are some dogs that just keep their hips flexed and they don't extend at all. If they really like to extend their hips, then swimming is really good for that, but ultimately really good for elbows, right? And front limb, because they have to really flex their elbows and their carpus. So swimming is, excuse me, really good for front legs. And then also really good for endurance as well. So the way that we introduce, depending on your setup, some places have ramps, some places have steps. I always like to put out treats around the treadmill to start. Like I almost going hand in hand for like what I do when I introduce them to the room. I like to be able to take my time here and not make them go in right away. So for this particular dog, I had already put out some treats around the treadmill. He was comfortable with it. Actually, he was just so excited to be like, "What is this?" And so I help him with putting some treats on the ramp, getting into the tank, and then usually I'll have them go in. This was already probably like his third or fourth time doing this, so he needed to go in. He would come back out. We would go back in, come back out. So we did that on multiple occasions. So sometimes I do that, and I might take an extra 5-10 minutes or so just to get them used to it. And then sometimes I might just put them in, close the door, and then bring them back out. So it's very different when you create an environment where you can get them accustomed to what you're doing versus just throwing them in. Water comes on, very loud noise, right? So there definitely are steps that we can take to really help them get the most success and make it a better experience for them. And then when you have the dogs that obviously love the treadmill, like this guy in the left and the right, and then my soul dog, who's the reason why I do what I do, he always loved the treadmill. And then we always like to put on some peanut butter. Or maybe some whipped cream cheese, whatever it is. And that usually kind of helps keep them focused as well. And so, additional modalities that may not be talked about often. This is postelectromagnetic field therapy. This is a great device that actually uses electromagnetic fields that helps to reduce pain and inflammation. So, as you can see, all these modalities. Remember, I said in the beginning, our ultimate goal is to help to restore tissue function, and by doing so, we really want to help to control pain and inflammation. So, a lot of these modalities do this. So, it helps to accelerate tissue healing. It reduces pain, inflammation, then also helping with some nerve function. And what's great about this device also is there is actually one out there on the market. It's called a CC loop. There's a couple of different ones now, but it's FDA approved as an anti-inflammatory device for owners to purchase at home. So they do, because it is a veterinary product. I'm pretty sure they still need to be approved by a veterinarian, but this is great for patients that can maybe are sensitive to NSAIDs, they can't have them at home. So to be able to apply, to purchase, it is a little bit on the expensive side, but I would think it's definitely worth it if it, helps the dogs or any patient, reduce pain and inflammation and feel better. But this is what it looks like. It's a little ring and it has a football shaped field that goes 2/3 one way, 2/3 the other way. So you can either place it on the patient or you could put it around them. And then now they have ones where you just turn it on, it automatically goes on for 15 minutes and then it will shut off on its own. So again, so you have a dog that's just chilling there watching TV, you can place it over their hips, their knees, wherever they might need some therapy, and it kind of just does the job for you. So we like using these in our orthopedic cases, whether it's post-op or even conservative, definitely arthritis cases, soft tissues, wound healing. And what's great about it too is that it actually can be applied over bandages or even any sort of gear. So even in like clothing. So if like you have an animal that has like a suit after like a post-op spay or something like that, or actually they have like these sleeves now for dogs so that they don't lick at them. You can put this will go through that as well. Whereas laser actually needs to make contact with the skin because it's the cells that are being absorbed by the light. This is electromagnetic field, so it's basically absorbed through anything. And then last is going to be acupuncture. So we do quite do acupuncture often. Acupuncture is the insertion of little needles into specific points, and this all creates a physiologic response. Many benefits of acupuncture, many years. It's like ancient medicine. So we really do get some great results with it. So not only for pain, for helping to reduce the body's natural endorphins, but also to help with spasms, muscle spasms, and trigger points. It can really help to bring in like a little microcirculation to alleviate that those pain and spasms, and then really good for improving nerve function. Um, Always very often use it on arthritis cases. Definitely a lot of neurologic conditions because it helps to improve some nerve function as well. Really good post-op pain control or even like your chronic conditions. So whether that's arthritis or any other chronic disease, really, acupuncture is just really good just for overall disease management. So there's multiple things that we can do with that, but for the purpose of this lecture I'm just going to say overall, but there's so much more that you can look into. I think it's a really great complement, especially where I work now. It's an integrative medicine practice and I really love the fact that we can incorporate acupuncture for patients that have chronic disease as well. Excuse me. Okay. And so the last thing I want to talk about is really being able to help to educate our owners on how that they can provide mobility and traction at home. So there's a lot of these great devices out there. So whether there's harnesses that this is called a help me up harness, really good not only for the dog but for the owner, right? So if we have these big down dogs that are pretty heavy and that they need some assistance getting in and out of the car, up and down, they have great devices for that. Giving mobility or just some sort of assistance really helps animals improve function overall. And keep in mind too, if an animal is in pain, pain can really exaggerate fear, anxiety, and stress. So if dogs are having an issue with mobility because of pain involved, they may be fearful of walking on certain surfaces of the fear that they might slip and fall, right? So being able to put down some traction, whether it's yoga mats, carpet runners, wherever you are, there's some great devices that you can give them to put on their paws. So whether it's these paws booties, which are almost like little like rubber balloons, this is a great product that I thought was good. It's called paw friction. It actually is like grounded down rubber. It looks like sand, but you glue it on the bottom of their foot, and that also helps. So many things on Amazon. If you just put in like dog traction or like traction socks, so there's so many different things that come up. And then over here, which is really important if you take anything out of this lecture, is to remember to shave the bottom of these dogs or the paw pads. I think it's really funny when we do surgery. We'll basically shave all the way down, especially for like a knee. They'll shave all the way down to the metatarsals, which is like right above the bones, like right above their digits. and leave all this hair on their paw. But meanwhile, they're supposed to be recovering and weight bearing on that leg, right? And there might be some pain and inflammation afterwards. So if they have traction, they might feel a little bit more comfortable about placing that leg. So if that's one thing that you take from this is if you see a dog, especially a dog with mobility or pain issues, take an extra few minutes just to shave up those paw pads, because it's almost like that, like us walking on socks, right? If you have a really slippery floor and then, it's like you go ahead and slip, right? Or you're probably going to be a little bit nervous of the way that you're walking. So you're going to change your gait a little bit. So that's exactly what the dogs will do too. The fear of falling, they will change their gaits, and we want to be able to keep them as comfortable as possible and mobile as possible. So shave your dog's pads, and definitely try to encourage the owners to get some sort of, whether it's a harness or putting down some traction for them. And then our role as rehab nurses. So as you can see, we do so much. The rehab world is very, very rewarding. The connection that we have, like not only with our patients, but then also with our clients, it's a really great place to be. We're mostly doing the ones that do all of a lot of the treatment. So there's a lot of autonomy in there, not only with those modalities, but we're skilled in manual therapy as well. So we do massage and manual therapy. The exercises, we like to make it fun. We also can assist in the treatment plan. The doctors usually create the plan, but since we're the ones that are working with the patient, we do, depending on I mean, obviously, like, the relationship you have with your vet, but we are able to notify them of any changes, like how is the patient doing. We're always updating them on the patient progress, or if the patient is not responding, right? So if the therapists create a plan and then here we are a couple of weeks and we don't see that the pet is responding the way that we want, or maybe we're seeing some changes such as or no improvement, whether there's any more increased signs of pain, is there any swelling, anything that could be causing a delay in the recovery, then we definitely want to be able to speak up and communicate with the vet and let them know this is what we're finding. Is there something that we need to do differently? So really maintaining great communication between us and the therapist is going to be critical for the overall success of the pet. Um, we also, of course, as nurses, we're always assisting in the care and maintenance of the equipment. And as you can see, these are very expensive modalities, so it's very important to make sure that we do have some structure as far as like maintenance and planning for them, especially with the underwater treadmill. Sometimes people do weekly, bi-weekly, every other week, different cleanings, things like that. But we always want to make sure that everything is functioning well. And then client education is huge. Like we have such a great relationship with our clients. So not only doing home exercise programs, so whatever we do in rehab, we might only be seeing them once a week, right? So they need to be able to do other stuff throughout the rest of the week. So we're really valuable in creating a home exercise program for these owners to perform at home. And then we're also trying to keep up and with what medications they're on, because again, remember, we want to be able to manage pain and comfort for as long as possible. So making sure that they are taking their medications as directed. Sometimes owners like to do their own thing and stop, right, and not listen to the doctor recommendations, or they'll just start things on their own without even discussing. So we're always managing, or at least managing the client's expectations, and talking about medications as well. And then from a fear-free perspective, our pre-visit pharmaceuticals. So remember, if we have a dog that we know, especially that has been in other areas of the hospital, or other places before, they're known to be a little bit nervous coming in. I always want those animals coming in on either gabapentin or trazodone, or CBD oil, whatever it is that helps to take the anxiety down a bit. Because again, we want to be able to create a good positive experience for them. And even if they're on, just a little bit, it can even just be a low dose, just to kind of decrease that FAS, so that that way we can have a good positive experience. And I can tell you that 90% of the time, once an animal knows that they're coming to rehab, they catch on quickly. They know they're going to get massage, they're going to get exercise, they're going to get treats. It is a really fun environment. And so other ways that we can help with client communication is that Fear Free has these really great resources that we can help with clients. So if it's the first time you're talking to a client about coming in, whether it's like a rehab referral, we can always do these great interviews and just ask them specific questions on how we can create a better experience for their pet. And so this way we're prepared for success. And then I love the fact that Fear Free has these Fear Free Happy Homes. This is a free website that you can send to your clients, because this allows them to just to review and gives them tips of what they can do prior to the hospital, but then also when they come home. So just again, just helps to just additional education to help these owners prepare for success, especially when it comes for cats. Absolutely. And then, so if those of you who are looking to possibly pursue a career in rehab, these are all the great courses that we have now. Traditionally, it used to be the Canine Rehabilitation Institute and then University of Tennessee, which were the two main ones. But now we have some additional programs coming out of NC State, Healing Oasis, and then also the Chi Institute. Oops, sorry. So I'm not going to go over all this. This is actually going to be in your in a PDF for you guys, but I've just basically put down all the information there so that you guys can do your comparison. And it's really all about what works for you guys and what you want. I can honestly say that all these schools are great. I'm biased. I went to the Canine Rehabilitation Institute, and I love that. I just love the methods that they approach there. Now they have more of more of an online, like on site and online. So you're really getting a combination of both. But actually, a lot of those modalities, a lot of these programs are doing that now more often. But there's a lot of hands-on in that particular class. Other classes are also have hands-on as well. So it really just depends on your financial aspect and what you want to learn, or what you want to take from it. And if you talk to any rehab therapist, they probably all have their own opinion because they've all gone to different schools. But honestly, I think we're all here for the same reason, right? Because we want to be able to help our pets, and really just give them like the ultimate, I guess, the ultimate care that we possibly can, right? And so all these schools aim to do that. And then if you really want to take it a step further, like me, because I just love teaching, and I just love this field and what we do, you can become a veterinary technician specialist in rehab. So NAFTA recognized us as in 2017. Um, and so in order to qualify for a specialty, you have to at least be 2 years as a regular credentialed vet technician, sorry. And then 3 of those years need to be at least a full-time rehab technician. So really you're looking at 5 years in rehab alone, ultimately. Right, we'll collectively 5 years together with that experience of rehab before it being eligible for to apply. But if you are interested in looking further, there is you can go to our website, and we basically give you a whole guideline of how you can get started from the point system. So you can look at the point system to see what it is that you need to qualify. And of course, with everything, there'll be some case studies, some advanced skills lists that we have to do. And then, of course, the passing of an exam. And then with that, that is all I have for you. And I just wanted to present this slide. We like to say that rehab is our happy place. And as you can see, this is in honor of some of my very special patients. Actually, some of them are not with us and some of them still are. But every single one of these patients, as you can tell, really, really love what they're doing and where they are. And this is why we love what we do as rehab therapists. We love to be able to create a positive place for our patients, and really applying those fear-free techniques makes it even more valuable, because we're ultimately creating this great space where the client's happy, the patient's happy, we're happy, we love what we do, and it's all on their faces, right? They're clearly happy and grateful for what we do. So, and with that, I'm happy to answer any questions.
Thank you so much, Dina, for your knowledge and expertise. As Dina mentioned, for our last few minutes, we'd like to answer a few questions that have come in through the chat during the presentation, and any additional questions that anyone attending would like to add at this time. One great question that came in during the presentation, you mentioned, kind of some programs that they can do to go through, be certified in rehabilitation. But someone asked if you could share a little bit more about acupuncture specifically. of how you can gain experience, maybe what some formal education or certifications are for acupuncture.
So acupuncture, I would say there's a couple of courses for that. So acupuncture is specific to veterinarians. However, the Chi Institute, which is where I went, does have a course for veterinary technicians, but it's really more about, it teaches you about just the theory of traditional veterinary medicine. It will teach you some points because you can actually do some acupressure. But acupuncture itself is veterinary specific. And the Chi Institute is one of the main ones, but there's some other courses. I'm sorry, I'm not like familiar with the other ones. I can most certainly look that up for you. But as a technician, I know that you can take a technician route in traditional veterinary medicine for the Chi Institute.
Thank you so much for answering that. Another question that just came through is, could you touch a little bit more on what the veterinarian's role is in rehab? So they're a current veterinary student interested in rehab, but they would like to know a little bit more about what the role could look like for them.
Oh my gosh, so much. Well, so the role of the vet is like, for the most part, so you're going to go ahead and do that exam. What I talked about in the beginning, not only doing your thorough exam, but then also looking a little bit more to the musculoskeletal system as well. I do hear veterinarians kind of say quite often that since they became a rehab doctor, that they feel that their exam is just a little bit more comprehensive, because I guess like where maybe with general exam you may miss some soft tissue stuff. Now you're actually looking from a whole orthopedic soft tissue neurologic perspective, right? So you're actually like testing muscle flexibility and function. You have objective measurement. There's so much as a rehab therapist that you can do. And then you're the one that's really creating the plan. And then it's the technician that's kind of carrying out the role of that. I really believe, like, as the therapist, you're really the advocate for this pet, right? So you're helping them through all aspects of recovery and tissue injury, whatever it is. Prescribing the medications, that, staying up to date with, like, what is the best regimen for these cases. I think a lot of people these days are looking more to integrative medicine, but the reality is that, like, there really is a good complement between using pharmaceuticals and rehab. It's what we call multimodal approach, especially when it comes to pain management. But so valuable, I feel. So I mean, if you're interested, I say go for it, because it's like, oh no, it's just life changing. I feel like when you're in rehab, you like drink the juice and you're just there. You're there for life. It's good.
Wonderful. Thank you so much for that answer. And I know we had lots of exciting folks join us today. So we're right at about time. So I want to respect everyone's time today. So on behalf of Fear Free, I want to say a huge thank you to Dina and everyone who joined us today. The recording of today's webinar will be shared within 1 week to your email address that you registered with. So please be sure to follow us on social media and subscribe to our newsletter for invitations to future presentations as well. Our next webinar will be on September 20th and focus on freeing dogs from pain and fear. So register to attend on fearfreepets.com. We hope you have a great evening and look forward to seeing you next time. Thank you again.
Thank you.